On this Sunday night, Ontario's top doctor retires and the pandemic isn't over. Did acrimony between David Williams and Doug Ford lead to the early departure?
A whole bunch of red flags went up. I mean, what's going on?
Plus, the resume and record of his replacement. The oil sands outbreak, how the virus overwhelmed workers in Alberta. Operation Hubs, eliminating the backlog of surgeries because of the pandemic. And the horrific history of residential schools, how Canada is remembering the children lost.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight with a shakeup in Ontario public health. The province is replacing its top doctor, even though the COVID-19 health crisis still isn't over. Dr. David Williams was always set to retire, but he delayed his departure because of the pandemic. And critics are wondering, why now? Our Ottawa correspondent Mike Le Couteur is looking into this. Mike?
Well, Robin, the news of Dr. David Williams' departure has Ontario opposition MPPs asking a lot of questions about the timing and the reason behind it.
A whole bunch of red flags went up. I mean, what's going on?
The Ontario NDP health critic was blindsided by the news, especially since Dr. David Williams had indicated he was willing to push back his February retirement date and stay on until September. France Jalina points out former General Rick Hillier was hired on a short contract to handle Ontario's vaccine rollout, but he decided not to stay on longer.
And as the vaccination had not even reached 1 million Ontarians, there he was gone.
The Ontario government did not respond to our request for an interview, but in a statement, Health Minister Christine Elliott thanked Dr. Williams for his years of service and praised his work. Premier Doug Ford has often done the same, but he hasn't always been on the same page as his Chief Medical Officer of Health, most recently on children returning to school.
And it'd be great if the students, in my mind, could be back in for those 3 to 4 weeks before the summer break.
So we want to be very, very cautious. The science table has said that we open the schools, these numbers are going up.
To some infectious disease experts, there was often a disconnect between Premier Ford and Dr. Williams.
Even though we were told that a lot of the evidence was, a lot of the decisions were based on what the science table was saying or other experts were saying, I didn't see evidence of this in many of the policies.
Dr. Williams' replacement will be Dr. Kieran Moore, who is Kingston's Officer of Medical Health.
They've only had 3 deaths in that entire region related to COVID-19. And really, that's a testament to his leadership.
Doctors Moore and Williams are expected to work side by side for the next few weeks to ensure a seamless transition. And Dr. Williams' last day is June 25th. Robin?
Mike Le Couteur in Ottawa. Thanks, Mike. More than 8,000 oil sands workers have now received the first dose of vaccine in a province working to contain outbreaks of COVID-19. In recent months, the virus has swept through more than a dozen of these work sites in Alberta, infecting thousands. As Heather Yourex-West explains, the blame is being put on a federal government exemption.
The variant-fueled third wave hit Canada's oil sands workers hard, infecting nearly 3,000 people in 2 outbreaks alone at Canadian Natural Resources Horizon mine site and the Mildred Lake site operated by Syncrude. By May, there were more than 1,300 cases at Mildred Lake. Horizon had more than 1,500. 3 workers there died. According to both companies, strict COVID safety protocols were in place, including rapid testing and mask requirements. But both CNRL Horizon and Syncrude Mildred Lake also proceeded with spring maintenance projects. It meant 5,000 additional skilled workers were brought to the Horizon site, 2,000 more to Syncrude Mildred Lake.
I do believe it probably is connected to travel with workers coming in from out of the province and out of the country.
Workers traveling to the oil sands from out of country were given a federal exemption from the 14-day quarantine requirement. Syncrude brought about 60 workers from outside Canada. In all but a handful of cases, the company says it required a 14-day quarantine anyways. But at CNRL, another 60 workers brought up from the U.S. were not required to quarantine at all. A company spokesperson says All federal and provincial requirements for sectors designated as essential services were followed.
If they're providing exemptions and then there's outbreaks, I mean, there's a pretty obvious link between the two.
With thousands of workers now partially immunized, outbreak numbers are coming down. But after so many infections, several workers still in hospital, and 4 dead, many questions remain. Heather Yourex-West, Global News, Calgary.
Throughout this pandemic, Canada's healthcare system hasn't had a break, and there's still the backlog of surgeries that were cancelled. Hospitals are under immense pressure to cut down the wait lists. But how? As Mike Drolet reports, one proposal from across the pond might offer a solution.
With COVID-19 numbers in decline, Ontario hospitals are looking to make up for lost time. But there's only so many hours in a day, and the backlog of surgeries canceled because of the pandemic is staggering.
We can't have people working flat out 24/7. It may be necessary to increase service volumes by some degree. That may be necessary over the foreseeable future.
No province saw its wait list for non-urgent surgical cases increase as much as Ontario, with the current estimate around 440,000 surgeries. Nationally, the picture isn't all bad news. BC cleared out most of its wait list by having surgeries at night and on weekends. Alberta is looking to private clinics to help it catch up. And in Ontario, the current plan is similar to BC's, but a provincial committee crunched the numbers and came to the conclusion it would take 3.5 years to clear the backlog. The UK has a similar problem on a larger scale, with a backlog of an estimated 5 million surgeries. It's a massive problem that's led to an innovative proposal, the creation of surgical hubs that specialize in specific areas like knee replacements. The idea is to become more efficient, but Canadian healthcare leaders worry it could lead to bigger problems.
We don't want to sanction these things for a short period of time and then, create almost like an assembly line effect where we're just pumping through volume without really a lot of quality measures in place, because that's another detriment to health and healthcare overall as well.
The problem with Canadian healthcare, say experts, is that it's not efficient, and that's nothing new. Wait times vary from doctor to doctor, even if they work in the same field.
It's a situation where everybody knows what the right answer is.
What he's referring to is the single entry system, similar to the queue at customs, one line that leads to all the experts.
This is a generational opportunity to take advantage of a crisis, to create health system reform that were absolutely critical before the pandemic hit.
Studies have shown a single entry system could improve wait times by up to 30%. It would be a big change, but are we ready for it? Mike Drolet, Global News, Toronto.
The acting head of Canada's military says he's committed to making sure victims of sexual misconduct feel they can speak out. Lieutenant General Wayne Eyre appeared on this week's edition of the West Block, his first TV interview since taking command of the Canadian Armed Forces in February. Eyre shut down Operation Honour, a mission that several victims felt had been poisoned by the allegations of sexual misconduct facing the military. The Lieutenant General says the top brass hopes to learn from the failures of Operation Honour, but right now, supporting victims is the top priority.
The real tragedy is we have complainants who have carried the pain of what has happened in the past for decades. And so helping them, supporting them achieve closure is absolutely has to be at the top of the list in helping us get through this.
And you can watch the full interview later this evening on the West Block, right here on Global. In the U.S. tonight, House Democrats say there will be a congressional inquiry into the January 6th riot on the Capitol, even after Senate Republicans voted to block an independent commission to investigate. Democrats claim Republicans are still trying to protect former President Donald Trump, who's accused of inciting the riot. And it's all happening as Texas moves to pass strict voter laws with the belief that voter fraud cost Trump the election. Jennifer Johnson reports.
Democrats and some Republicans vow to get answers as to who organized the mob that stormed the U.S. Capitol January 6th, even after Senate Republicans blocked an independent commission's investigation.
What we really need to know is what was Donald Trump doing in the hours before the riot, during the riot? What was he talking to or telling his advisors?
Democrats are pushing for a bipartisan committee with subpoena powers to get answers. Some Republicans say the vote was a slap in the face to Capitol police officers who risked their lives to save U.S. lawmakers.
Our officers are hurting right now. People need to know that those Capitol officers that they walk by every day, they want a commission.
Right.
They are hurting. They are leaving in droves.
Critics charge Senate Republicans are trying to protect former President Trump, who encouraged the mob to stop the certification of the election, claiming he was the victim of voter fraud.
We will stop the steal.
Backing that baseless claim, Texas Republicans are now on the verge of passing new voter restrictions, following similar laws passed by Georgia and Florida.
It's going to disproportionately impact people of color. You have to understand the damage that you're causing.
The Texas bill gives partisan poll watchers more power, adds new ID requirements for mail-in ballots, cuts back early voting hours, and makes it easier to overturn election results. Since the election, Republican-backed measures making voting more difficult have been introduced in 43 states. Despite protests, the Texas bill is expected to pass and signed into law by Governor Greg Abbott, a longtime Trump supporter. Jennifer Johnson, Global News, Washington.
Coming up, German researchers may have an explanation for the vaccines causing blood clots. There are still questions surrounding the safety of the AstraZeneca and Johnson & Johnson vaccines. That's because of the extremely rare but serious blood clots reported in some patients. Now, German researchers believe they know why there's this potentially deadly side effect and how it can be prevented. Crystal Gumansing explains.
It's one of the most significant mysteries in modern medicine, and it's gripping scientists and spurring research that's unfolding in real time.
You ready?
Why vector vaccines like AstraZeneca and Johnson & Johnson have resulted in extremely rare cases of blood clotting. The key may be how these shots enter the body on a cellular level and teach it to recognize the virus that causes COVID-19. German researchers theorize the rare events could be the result of vector vaccines sending DNA information into the nucleus of cells and not the cell fluid. Inside the nucleus, it's converted into RNA before it leaves the cell, possibly without all of the information being transferred. Biochemistry and biomedical associate professor Matthew Miller says the findings are plausible.
The cell can make some changes to the mRNA such that the spike protein of SARS-CoV-2 no longer stays attached to the cell that's making it, but instead gets secreted into the bloodstream, for example.
Thromboembolic events associated with the vaccines led to numerous reviews by drug regulators. All found the vaccines to be safe. Still, people became fearful of the rare side effects.
What the authors of this study propose doesn't really explain why these rare people experience this outcome and not everyone.
The vaccine manufacturers are investigating the causes of the rare blood clotting events, while the German research, which has not been peer-reviewed, doesn't provide all of the answers. It's a start, says Jonathan Ball.
If you can tweak the sequence of the gene that you've delivered into the nucleus, it might be possible to stop that processing from happening and therefore potentially prevent those altered gene products, those altered proteins from being produced.
More work is still needed, but these findings could lead to improvements with this current generation of vaccines, as well as future shots.
Bring it on, bring it on.
Crystal Gumansing, Global News, London.
Our next story is about misconduct allegations against a former high-ranking Mountie. Allegations that recently surfaced during a murder investigation in British Columbia. It's raised questions not only about how that case was handled, but how RCMP investigated one of their own. So who's policing the police? Jules Knox reports on the calls to reform the system.
Senior ranking Mountie Brian Gately had the phone of a dead woman hacked into by a colleague using RCMP equipment. He did so as a favor to a personal acquaintance, her husband, who said he wanted its photos from the couple's last day together. RCMP launched a code of conduct investigation into Gately over the hack and over a potential conflict of interest for allegedly giving his personal opinion to officers investigating her death. But the allegations against Gately did not go to a public conduct hearing. Gately resigned.
Well, what happens is it's over. As soon as they resign, the file's declared closed. Nothing happens.
In September, RCMP said that when an officer resigns, they're no longer subject to code of conduct and any ongoing investigations would cease. But they backtracked this week, clarifying that the investigation is finished. But those findings aren't made public. In a letter to the woman's family, Gately admits he had the phone unlocked, but after RCMP returned it to the husband, as police were still treating her death as an accident. It was before the murder investigation began. Gately says he was not involved in the case and denies his actions had any impact on the investigation or the prosecution. Others aren't so sure.
The actions of Gately were such that it does call into question whether he obstructed justice.
Although RCMP became aware of the allegations against Gately in December of 2017, that conduct letter wouldn't be written for another 9 months. It was finally signed by Assistant Commissioner Kevin Hackett, who also happened to be the chief officer of BC's organized crime agency at the time, where Gately landed his next job.
It is simply, birds of a feather flock together. They stick together.
Gately and Hackett declined Global's requests for interviews, but this is not an isolated story. From 2009 to 2016, more than a quarter of Mounties facing conduct investigations resigned. Criminology professor Daryl Davies says there's a serious lack of accountability and a hidden cost for taxpayers.
If you've been charged, you can ride out the time for months, if not years, suspended with pay, and then days before your trial's due, simply resign.
Even former Mounties are demanding change.
I think suspension without pay for a serious, grievous offense, that should be automatic.
I actually would not have police investigating police. There must be an oversight body that has teeth that can actually enforce what they're doing.
Canada's public safety minister would not comment on calls for legislative changes.
At the end of the day, the police even investigate the police. I mean, it is, I hate to say it, but it's farcical. It's been going on like that for years.
And he adds, too often it's the victim, not the officer, who ultimately pays the price. Jules Knox, Global News, Kelowna, BC.
Up next, old wounds reopened after the discovery of a suspected mass grave. Why Canada's dark chapter isn't over yet. Flags are flying at half-mast across the country for what is believed to be a mass grave in BC. The chief of the Tk'emlúps First Nation says the remains of as many as 215 children were located on the property of an old residential school. The practice of taking Indigenous children from their families is forever a dark chapter in Canada's history, and the deep pain persists. But as Ross Lord reports, there are calls to move forward with reconciliation.
If making sense of it is impossible, Canadians are at least trying to do something about what happened at this former residential school for Indigenous children. Among the tributes across Canada, many symbolize the number 215, the estimated number of children whose remains have been discovered in unmarked graves, according to the Tk'emlúps First Nation. Flags are being lowered, including at Ottawa's Peace Tower and at other government buildings. There are calls for a national day of mourning from those who consider these tributes only the beginning.
We're going to most likely be bringing them home, which means potentially unearthing them and going through and identifying them and then seeing which community they belong to. So that's going to be so hard and so horrendous.
I felt grief, and I felt a little bit angry as well, and I'm not an angry person by nature.
This First Nations chief suggests only after a long period of reflection has he managed to find anything positive.
These children's hurt is gone. Their pain is gone. They're at peace. This is now about what we do to remember this moment, but also how do we go forward from here?
There are other questions: how to fit the discovery into the already disgraceful history of residential schools and into the pursuit of reconciliation. How to help our own children understand it, especially Indigenous students who live with the repercussions generations later. As Canadians look for new ways and new symbols to honor the children and their families, the full magnitude of the horror is unknown. The Tk'emlúps First Nation says preliminary findings should be completed by mid-June. It promises updates as they become available. Ross Lord, Global News.
And that is Global National for this Sunday night. I'm Robin Gill. We leave you tonight with more tributes from around the country for the countless children lost in the residential school system. Thank you for watching. Donna Friesen will be at the anchor desk tomorrow. Good night.